In this video series, I'd like to compare policy proposals by Hillary to policy proposals by Trump. Many Democrats have this partisan affinity for Hillary. They feel like she represents the Democratic Party, and so if I'm a Democrat and if I am working class, then she's got to be better. But it turns out that that's actually not the case at all. The traditional party distinctions no longer apply in this election, and many astute analysts have indeed noted this, but I'd like to just reiterate it and prove it by actually looking at the policies. So, without further ado, let's look at the policies, not what they say at pep rallies. Okay, we know that Trump says some obnoxious things and is insensitive. We know all of these problems, and he has a gigantic ego. All of these problems, personality flaws, are well known, and we also know that Hillary is, she's very good at trying to appeal to people who do not have an in-depth understanding of issues, and to flip-flop as the latest polls indicate she should be presenting her case. So those things are well known. But let's look at the actual at substance. So first, I'm going to go through with Trump. What does Trump propose? So I'm looking at the website. I'm going by the website. This is a pretty good, reliable source of what their policy positions are. So according to Trump, one thing that he mentions regarding healthcare is eliminate state border restrictions. He believes that if insurance companies can sell across state lines, they can sell to customers living in other states, then that will introduce more competition to the market, and it will lower the cost of premiums. So, is this a good policy? In my opinion, no. Okay, let's just say it's not a bad policy, but it's kind of dubious. In one analysis of this, I read that he believes it's bad because what's going to happen is that insurance companies will base themselves in the state that has the least restrictions, and thus will get away with anti-consumer policies and ways of doing business. Okay, because they're going to go with the state that offers the most pro-business, the most pro-insurance company laws. So this is one possible reason why it should not be done. But overall, I think that this is a dubious proposal because there is plenty of free market opportunity within a state. I mean, it's not like a state is not going to open an office. It's not like an insurance company is not going to open an office in any given state because it's just not worth it, because the state is too small. I mean, there's plenty of reason for them to go through the paperwork and the state to qualify to meet the state regulations in order to be able to open an office in that state. And there's plenty of competition as is. I mean, if you go to any exchange, there's plenty of competition. And 5 or 6 is way more than enough to keep it competitive and to keep prices low. So that's not the issue. So I'm going to put a question mark on this. It's not necessarily a horrible proposal, but I don't think this is going to address the issue. Moving on. Tax-free HSA contribution. So Trump proposes that people should be allowed to contribute to a health savings account. That's a private account that can only be drawn on for healthcare purposes. And you contribute to it with pre-tax dollars, meaning you're not taxed on you don't pay income tax on those dollars. And likewise, when you draw the money from the account for health expenditures, you don't have to pay any tax. So this provides a natural incentive for people to actually save money for healthcare purposes. Now, what is the? Now, this is a very good proposal in my opinion, and I'm actually pretty astounded that this hasn't been implemented until now. And there's actually no reason why this hasn't been implemented until now. Right now we have the ACA, so that kind of addresses this issue. I'll explain in a moment. But this should have been done a long time ago, and here's why. The traditional model of employer-based coverage is a tax-free model because employers do not pay tax on those premiums that they pay to that insurance company. Okay, and so why would somebody who is buying their own insurance, who's not getting coverage through an employer, why should they not be eligible for that very same tax deduction. And if the employer gets to deduct tax expenditures, which is ultimately passed on to the employee through lower wages, through higher wages, I should say, right? In other words, they can offer the insurance at a lower cost to the employer because they're not paying taxes on those dollars. So they can, right. And so if the employer gets that benefit, why should the private purchaser not get that benefit? So that's clearly an improvement upon the pre-ACA status. ACA meaning, of course, Affordable Care Act, also known as Obamacare. Now, with Obamacare, this is no longer much of an issue because now, not only do you get tax deductions for premium expenditures, but you actually get tax credits. Most people, unless you're making a lot of money, you actually get even better than a tax deduction. You get a tax credit, meaning for every dollar that you're spending, you get actually a dollar back, and you don't have to pay taxes. So that's even better than a tax deduction. And so assuming that ACA stays in place, this proposal doesn't really mean much. But of course, Obama is proposing to repeal the ACA. Now again, let's balance it out, because again, we tend to be partisan and we think, oh my God, this is Obamacare is the foremost accomplishment of Obama in his entire 2 terms of office, and this has got to be the best thing that has happened to the Democratic Party and to those who vote Democratic. But not necessarily. You have to look at the issues. So let's put our biases aside and look at the actual ramifications in whether we maintain the ACA or whether we repeal it. And so again, first I'm going through Trump and I'm trying to analyze his positions here. If the ACA, if the Obamacare is repealed, a citizen will still be able to get tax deductions on an HSA. Now, so why is this a good thing? So let me explain why this is a great thing, assuming that the ACA is repealed. I think, in my opinion, and in many experts' opinion, the fact that private people, this whole employer-based coverage has been a disaster to this country. And I don't have too much time to go into details, but let's just say the problem is here that there are too many middlemen in the process of providing care. And the fact that I pay, the employer gives health coverage to me as a benefit, right? But they don't give it directly to me. They pay money to the insurance company. The insurance company pays it to the clinic pays it to the doctor, and the doctor provides the service to me. There are so many moving parts here that there's absolutely no transparency. And nobody knows what's happening, and there's so much room for waste and abuse and fraud. So this motivation for employers to provide coverage, okay, because we had a tax system that incentivized only employers but not private people to purchase health coverage, resulted in actually jacking up the prices. So because of all this waste and fraud. And so in my opinion, if HSAs became commonplace, then in my opinion, this would provide a tremendous counterbalance to the current high prices that stem from this abundance of middlemen, of intermediaries in the provision of healthcare. So even if we repeal ACA, I think that HSAs would have been a great idea, a great reform, and it would definitely lower prices. And in a way, it's even better than the ACA because as it currently stands, the ACA did not address the fundamental problem with the healthcare industry, which is that there's too much waste and abuse. Now they tried. I know that the ACA made many efforts at that. Tried to provide smoother billing and so on. But I think that all of this is just not. All of these efforts were wrong-headed because not all of them, but they're not. They don't address the substance of the problem. The substance of the problem is there are too many middlemen, and there are too many natural, innate incentives in the market to provide unnecessary care, and the ACA just didn't do that. I know they tried to measure instead of pay per procedure, they try to measure the overall effect that a physician has on a patient's health and so on. but it's just so difficult, especially when it's managed from a centralized bureaucracy. How are you going to track this? There's so many ways to manipulate this and to defraud it. It's not workable. A much more effective way is by eliminating all of these intermediaries and allow the consumer to have their own choice of how they pay and whom they pay. And with HSAs, they're paying the doctor directly. They're withdrawing from their account and they're choosing which doctor to go to. And this also addresses another problem which Trump brings up, which brings me to this to another thing that he mentions, which is price transparency. So that's another thing that he mentions. So he says that he's trying to enact a federal law that would require providers to be transparent with the prices of procedures and so on. And so I think this is a long overdue reform. This is like huge. This is a gigantic problem in the market, is that nobody knows. Like, even if I'm covered, I want to know how much my insurance company is paying on my behalf. And this is a problem, by the way, not just in the health insurance market, it's also in the auto insurance market, I noticed. Like, I'm digressing here, but I had several claims on my auto insurance policy, and I never knew how much the insurance company paid out on my behalf, which is ridiculous. And I was never given that opportunity to be involved in adjudicating whether, or in assessing how much should be paid out, which again I think is ridiculous, because they're doing it on my behalf, and they're acting as if I'm a child, as if I have no ability and no input into the process. But I do, because ultimately the price of my premiums will go up if my insurance has to make these payouts. And so yeah, it's the same thing here. I want to know, even if I'm covered through Medicaid, by the way, I had the same issue there. Like, I have no idea. I used to have Medicaid, and I have no idea how much they bill the government for my care. I have no idea, and it's ridiculous, because I want to know. I want to dispute that, because I see the government as my representative, not the Medicaid, not the clinic that provided care to me. So the government ultimately is using my tax money to pay them, and I want to be efficient in the use of that tax dollars. I just don't want the government to give them money if they don't deserve it. And so why wouldn't the government tell me how much they paid to the clinic? The government doesn't do that, and the clinic, of course, doesn't do that. And so this is, in my opinion, a big problem. But with HSAs, price transparency will be natural, and that would probably force even employer-provide coverage, if it'll still exist even. It might actually completely eliminate employer coverage, but it'll force them also to be more transparent, because right now there is no transparency, period. Nobody knows. If you walk into a hospital and you ask them how much would this service cost, they can't even tell you. Only weeks later do they figure out what the billing is. They cannot even give you a reasonable estimate. And there was a long article in the New York Times about this a few years back. Anyway, so on HSAs, I think it's a great idea, considering there are no ACAs, considering ACA is repealed, as Trump proposes, and price transparency, awesome idea. Another thing he mentions is, this video is going to go on for a while. I've been speaking 13 minutes. Okay, bear with me. A block grant of Medicaid to the states. So what is he saying here? As it currently stands, when the federal government gives money to the states to offer Medicaid coverage to its citizens, it does so under certain stipulations. It says, for example, okay, I'm going to give you an additional, let's say, $50 billion, okay? And the government says, okay, submit a proposal and tell me how are you going to expand coverage through this additional funds. What are you going to do? Are you going to raise, let's say, the minimum, the maximum income limit from, let's say, $30,000 for a family of three? You're going to raise it to $40,000? And show me the numbers, is what the federal government is going to say to the state. And so the state has to show the numbers and justify how it is allocating that additional funds. And so what Trump is proposing is that the state shouldn't have to justify how it is doing it. What is the rationale behind this? And so he argues that this provides an incentive for the state to try to eliminate waste and fraud. So the argument goes that if the federal government is going to give money to the states to pay to pay for the expansion of Medicaid based on the services provided, then there's no incentive for the state to keep the costs down because they're simply going to pass the bill on to the federal government. However, if you give them a block grant and then you say, okay, this is it, this is it, you take it and you figure out what to do with it. And so if it is efficient in the way it allocates those funds, then it gets to, do its own thing, and it can basically reduce costs. So in my opinion, this is always a good policy. I'm very much, when it comes to centralized policy versus localized policy, I'm a strong proponent of localized policy. And again, I'm digressing here, but in education, I'm a very strong proponent of the federal government getting out of the business of micromanaging education. If it still wants to provide funds from a centralized, treasury to the states, then it should do so without any conditions at all. It needs to trust the states to do the right thing, period. As long as they're not, as long as they're not discriminating, whatever. These things are already law in the states anyway. But there shouldn't be any of this micromanaging. Okay, so this is a great policy position. Moving along, remove pharmaceutical entry barriers to the market. And so let's analyze this position. So what Trump is saying here is that if a pharmaceutical company that is not registered, that is not based in the United States, wants to sell drugs to the United States, they should be able to sell it to the U.S. Let me revise that. The U.S. should be able to buy drugs from abroad. Okay, because right now, whoever is directing the Medicaid or Medicare fund in the federal bureaucracy does not have the authority, the mandate to go and look for cheaper prices abroad. And so what he's saying is they should have that authority to do so. Put a different way, I'm not sure why he doesn't phrase it this way, but put a different way, this also means that the federal government is allowed to negotiate with domestic pharmaceuticals for better prices, because that is in effect what's going to happen. Because I can guarantee you, the moment the government starts purchasing drugs from abroad, at lower prices of course, the domestic manufacturers and distributors will immediately come running and knocking on the door and saying, oh my god, please purchase from me, I'm going to lower my price too. Okay, so this allows the government to negotiate. Indirectly, it allows them to negotiate. So you could have said directly, you could have said just simply that the government should be allowed to negotiate. Right now, as the rule stands right now, even under Obamacare, the federal government does not negotiate under Medicaid, Medicare. I believe that in neither program does the government negotiate. It's possible that in one of the programs it does have a little bit more leeway in negotiating. So don't quote me on that. But I know that in one of the other programs, they don't. Meaning that the administrator of the program is not allowed legally to use the purchasing power of the federal government to negotiate a better price. And this is just completely commonsensical. Like, imagine if I were running a company that uses a lot of copy paper, right? So it makes a lot of sense for me to pick up the phone and, talk to different distributors of copy paper and get the best quote and tell them, I'm offering you a lot of business, but you need to give me a good price for that volume. Okay? And in fact, if I were not to do that, I would be completely remiss in my duty in my fiduciary duty towards the company that I work for. It's completely natural for me to use my volume to negotiate a better price. However, legally, the government is not allowed to do that. And this is an outrageously ridiculous handout to big business. Talk about corporate welfare. This is it. This is like a gigantic handout of tens of billions of dollars every year to big pharmaceutical companies by saying that the government not legally allowed to negotiate for better prices. The government will pay the same price that these pharmaceutical companies charge private insurance companies, who of course have much less bargaining power. Okay, so indirectly that's what Trump is saying by saying that we can bring in cheaper pharmaceuticals from abroad. Moving along. Okay, so Trump mentions that by enforcing stricter immigration rules, not allowing illegal immigrants to enter the country, we can also cut down on our expenditure of healthcare of healthcare for illegal immigrants. And so note that he's not saying, this is important because many people are maligning him for being anti-immigrant, but he's not saying that that illegal immigrants are already here should not be provided care, or the government shouldn't pay for them. That's not what he's saying. He's saying that we could significantly reduce the cost. He mentioned $11 billion as the price tag that the government pays for illegal immigrant healthcare. And so what he's saying is we can eliminate that, or at least reduce that significantly, if we impose stricter entry laws and enforce them stricter. And so I think that this is a perfectly legitimate position. In fact, I think that you should at least consider going even further. I'm not necessarily saying we should do that, but we should at least consider to what extent do we really want to offer them the coverage that we currently do. Because currently, the current policy is if you're an illegal immigrant and you walk into a hospital and you claim an emergency, they will provide you care and then they'll bill the federal government for it. And I think that this needs to be questioned. I'm not necessarily saying that the government shouldn't pay. There's a certain argument to be made that we need to be compassionate, but I think that insofar as this is being abused by illegal immigrants, meaning that they're coming into this country on purpose, knowing that the federal government will foot the bill, it becomes a problem. And insofar as that's the case, we need to address it. I don't want, for example, a pregnant woman from Mexico crossing the border and then say, okay, I'm here, I'm giving birth. And then, of course, the hospital will accept them, and not only will the government pay for the birth expenses, but the child will actually be a citizen too, also known as an anchor baby. So I think this is ridiculous, and I don't think anybody, even the most ardent Democrat, would defend such a status quo. Like, I mean, certainly we need to do something about it, right? It makes no sense for us to be footing such a bill under such circumstances, or at least to allow this to be happening, to continue to happen. So yeah, so I think he makes a very valid point here. Lastly, he says that if we offer better jobs and a stronger economy, then the Medicaid rolls will go down, will decline, because people will make more money and they wouldn't qualify for Medicaid. Once again, a very strong argument. Now, of course, how is he going to improve the economy? That's a totally separate question. But of course, Trump is sometimes a little vague on that. He says, I'm the best negotiator, I'm going to negotiate with China, and it's going to be great, and it's going to be fantastic. And so we don't always know what's happening here. But as a general policy, as a general vision, it certainly makes sense that if those costs are reduced, that if better jobs and higher paying jobs are offered and available to people, then the cost of Medicaid will go down. So, out of all the policies that I mentioned thus far, there has not been anyone that is really bad, and there have been several good ones. And so overall, let's just back down and take a just nice and calm and composed look at things. Let's not get hysterical here, okay? I know he's saying, let's repeal Obamacare, and people freak out, if you're a Democrat, no, he's repealing Obamacare, oh my God. But realize that if these positions were in fact enacted, then in many ways it'll be even better than Obamacare. Which brings me to a very important point that I'm trying to make. That Obamacare, actually, looking back, at the time I was a strong proponent of it. Of course, I was clamoring for the public option, and I strongly believe that universal care would be even better, which is why I support Bernie Sanders. But that's a separate story. But as it stands, I still think it's an improvement over the status quo of 2008, 2009, prior to its enactment. However, looking back, I think that it failed. In many ways, it failed. How so? Well, the problem right now is one of the things I mentioned earlier already, which is that it hasn't been able to address the fundamental problem of too much waste and fraud and too much unnecessary care being provided under the current system. So while it makes it more affordable for working class people through federal credits, okay, and it streamlines the process a little bit better, and of course it addresses many other issues such as pre-existing conditions and so on. However, the fundamental problem wasn't pre-existing conditions. Pre-existing conditions is a secondary problem. The fundamental problem is it costs too much money, right? Because it costs so much money, that's why they have to. The insurance companies are protecting themselves. They become defensive, and they erect all of these different barriers to try to keep high-cost policies out, right? But if we can tackle the core of the problem, which is that we're just paying too much money for care that is unnecessary and ineffective, if we address that problem, then the entire necessity for any reform and any large-scale ACA type legislation would be eliminated. And so I think that under these policies, the HSA, great policy, allowing foreign pharmaceuticals to sell to the U.S., allowing the U.S. government to negotiate, great idea. Price transparency, fantastic idea. And so these things are great ideas. And honestly, given the current state of the way ACA works, I would, in a heartbeat, swap out the ACA for Trump's proposal. I don't think that it would be any worse, and it might be significantly better. Because the ACA, oh, by the way, I didn't mention another problem with the ACA is that there's high deductibles also. And deductibles have been going up. And so, yes, so even if I qualify, and even if they sell me a policy, and even if I get all those tax credits, I'm still stuck with high deductibles, which kind of negates the whole purpose of it, because part of the solution of the ACA to the problem of medical care is that it offered preventive care, right? But if I'm not going to use preventive care because I'm trying to not dig into my pockets, right? I'm trying to avoid having to pay out-of-pocket expenses, then you're not going to achieve that anyway. And besides, the whole point of paying an insurance premium is that I shouldn't have to pay out-of-pocket. And so this is seriously a problem with the Affordable Care. It's better than than the conditions prior to the ACA, but it's not a complete solution. Okay, so I covered Trump's position, and I've been talking for 27 minutes. So let me get to Hillary's positions and get to my point. So one thing that Hillary says on her website is defend the ACA. Okay. Obviously, it means nothing, right? Defend the ACA. I mean, what are you trying to say here? You're trying to say the ACA has no problems? Of course it does. You're trying to say that we cannot, God forbid, repeal it because then all hell is going to break loose? Well, that's not true either. I mean, you can't be dogmatic about this. You have to be realistic and look at the actual effect of the program and see if it works, see if it doesn't. And, it's perfectly fine. She keeps saying, we're going to build on it. Now, it's perfectly fine to build on it, but insofar as sometimes you have to deconstruct in order to reconstruct in a better way, then so be it. So, clearly, sometimes there are problems that do not allow for patchovers. So, let's see what she says more specifically. She says, there you go, another generality. Crack down on prescription drug prices. What does that mean? Now, again, it's known that, not again, but let me say this for the first time. I say again because it's been reiterated so many times already. But it's known that Hillary has accepted donations from pharmaceuticals. She's given speeches to pharmaceuticals, and she's accepted hundreds of thousands of dollars for those speeches. And so we really need to know what she means here, because if she means that when she says crack down on prescription drug prices, if she's saying that what I mentioned earlier, that the government should be allowed to negotiate, or what Trump is saying, that the government should be able to import drugs from abroad, which is kind of the same thing, then that is a very bold statement. And clearly, if that's what she meant by crack down on prescription drug prices, then say it. Because, if anything, I'm going to be, rightfully so, suspicious that you're in bed with the pharmaceuticals, and you would try to protect them because they donated to you, and you would be on their side of things. And so if anything, you need to be very specific with what you mean by this, because otherwise I'm going to assume that you're just simply basically going to, it's just speech. You're talking the talk, but you're not going to walk the walk. Protect contraception. Okay, this is a favorite talking point of Hillary Clinton, especially, but the Democratic constituency in general. in my opinion, it's completely overrated. It's inflated, this talking point, because for the most part, the Republican Party does, for the most part, okay, I'm qualifying here. For the most part, they're not advocating completely eliminating contraception services. Like, for example, the controversy surrounding Planned Parenthood, whether the federal government should fund it, is clearly, let's limit ourselves. Let's understand what the controversy is. It's not about whether women do have access to contraceptive services. Of course they do. The question is whether the government will pay money to Planned Parenthood for this service. Okay, so it's pretty limited here, and I'm pretty sure the Republicans would be satisfied if Planned Parenthood can somehow isolate what the money goes for, and if Planned Parenthood can show the federal government that the funds it receives was for, I'm sorry, when I say contraception, I mean for abortion, right? I'm pretty sure that the Republicans will be satisfied if they can show that it's not used for abortion. And listen, abortion, I am on the pro-abortion side, also known as pro-choice, because nobody wants to say pro-abortion. But I understand that this is a legitimate argument in a democratic society. This is a legitimate issue to argue over. And in a democracy, if the majority of the people say that the government shouldn't fund it, then so be it. And this is clearly a result that I'm willing to accept. I'm willing to swallow if the democracy, if the people have spoken. Okay, I would be much more resistant if they said that if they outlawed it. Okay, but that's not really what's happening here. Roe v. Wade is still in place, and that's not really the discussion here. When Hillary Clinton says protect contraception and protect abortion, she doesn't use abortion, but that's basically what she means. She's trying to hedge her positions here. She wants to be a little centrist here and try to appeal to those, blah, blah, blah. Okay, so when she is implying here that she's going to protect abortion access to women, she's being deceptive here because, like I said, they already have it and they will have it anyway, even under the Republican administration. It just wouldn't be funded by the federal government. So moving on. Make premiums, Hillary says, make premiums more affordable. Oh, okay, here we go. How are premiums under the ACA, under Obamacare, going to be more affordable? So what does she say? Tax credits for premiums for those who... Okay, if you are spending above 5% of your income in out-of-pocket expenses, then this tax credit will kick in. So this is in addition to whatever tax credits already exist for those buying insurance in the exchanges, in the Obamacare exchanges. So in addition, above and beyond that, what Hillary Clinton is proposing is that, let's say, in my case, okay, this would be a good example. I make about $40,000 a year, okay, so 5% of that would be, 10% would be $4,000, 5% would be $2,000. So if I am exceeding that limit in out-of-pocket expenditures in medical care, then the credit will kick in. So above $2,000 of out-of-pocket expenses, there will be a credit up to $5,000. Now realize how, oh my God, how deceptive this thing is. This is almost completely meaningless. Almost completely meaningless, because think about this for a second. Okay, for a person like me, who, like, obviously, this is for a person who doesn't qualify for Medicaid, right? If you qualify for Medicaid, then this whole thing is a non-issue, right? So if you make less than a certain amount, then the government pays for everything. There's no out-of-pocket expenses at all. So this is for a person like me who doesn't qualify for Medicaid, right? You're making above a certain amount, okay? So if you make $40,000 a year, then the threshold is too high. 5% is $2,000. But if I have to pay $2,000 out of pocket, then that's problematic already. That's way too much. $2,000 a year, and I'm already paying premiums, and the government is already paying all of these tax credits, and all that money is already going to the insurer. So it's too high. It's too high. $2,000 is too high for myself, and the insurance company is getting paid too much money, and the problem is still there. You haven't solved anything. Okay, it's not more affordable for me by the government providing a tax credit above $2,000. Okay, and again, like I said earlier, if I make less than that, in which case the 5% threshold will kick in at a lower amount. Maybe it's going to be above 500 or above 1,000. But in that case, I have Medicaid, so I don't need this anyway. So this is a completely meaningless policy proposal. Okay, complete garbage. Next, she said incentivize states to expand Medicaid by giving them 100% coverage up to 3 years. Okay, so if the states okay, let me give you the background here. So when Obamacare was enacted, there was a challenge posed to the law. It was brought all the way to the Supreme Court, and the Supreme Court eventually ruled that the Medicaid requirement that states expand Medicaid, that was unconstitutional, and the states could opt out of that Medicaid expansion. Meaning that if the states opt out, it means that if you make, let's say, above $30,000, but below $40,000, then the state doesn't have to cover you under Medicaid. Okay, so Obamacare wanted the states to expand, but the Republican-governed states, chose to opt out as a sign of protest that we don't want Obamacare. Now, the irony about this, the paradox about this, is that the federal government was offering 100% coverage at first. Or 90%, I'm not sure which one, but I think it was 90%. 90% of the expansion. Okay, meaning whatever greater cost, additional cost the state is incurring by expanding Medicaid to this population, this bracket of $30,000 to $40,000 a year, the federal government was going to pay 90% of that cost up to a certain number of years. I'm not sure if it was 90 or 100. And so what Hillary is saying is, no, we're going to raise it to 100. Okay, I guess it was 90 because she's proposing that we should expand it to 100. So she's saying we're going to raise it to 100 for up to 3 years. Okay, but this is a joke because again, the Republicans are making a stand here. It's not economic. You think this 10% is really swaying them to reject it? That's not the issue. Of course, it's a phenomenal deal for the states if they looked at the numbers, at the actual financial numbers. The reason they're rejecting it is because they're taking a stand. They're taking a policy, an ideological stand here, saying that we don't want the federal government to be involved in this and forcing us forcing us to pay for this eventually down the road, or forcing us to expand Medicaid, period. And so this is clearly ideological, and so raising from 90 to 100 or expanding the number of years or whatever the exact numbers involved here is just completely meaningless, because that's not what the issue here is. So again, complete joke. Moving on, supporting the public option. So Hillary says she supports the public option. Finally, we come to the only position here that actually does have virtue to it. She supports the public option. However, the problem here is that, okay, let me back up for a second. Why is the public option good? Why is the public option good? Okay, so when the ACA was first considered, Obama was actually for the public option. However, he didn't get it. Why? Because the companies that he was negotiating with, all of these different actors in the provision of medical care, including the insurance companies, the pharmaceuticals, the clinics, the doctors, and so on, they didn't like it. They didn't like the public option. Why not? Because here's where it's very opaque. Like, nobody says this because it's just so sensitive. Nobody wants to say this. And this also shows you how deceptive she is in her campaign positions. The reason why they resisted it is because the public option would have offered much lower premiums than the private options. Now, why that is the case exactly, I'm not going to go into, because it's going to require another 5 minutes for me to explain why I would have lowered the premiums. But suffice it to say that it's just for the equivalent care that I can get by buying insurance by paying to a private company. Okay, I can get the equivalent care by paying the federal government, and they would give me something more or less equivalent. It might be a little bit inferior, but I can get something for much less in premium costs. And naturally, the private market would suffer losses. They would have to lower prices, they would make less profit, and so on. And that would offer competition to the private sector. And so that's why they didn't want it. And so if that's what Clinton means, but that's what Hillary Clinton means by saying, I'm going to support the public option. If that's what she means, is that she's actually going to do that, then this would be a great policy position. And this would be definitely a move in the right direction toward, period. It's a move in the right direction. I still believe that Sanders' plan is preferred by providing just simply universal coverage, government funded for everyone, and that simplifies everything and significantly eliminates a lot of the redundancy and the waste and so on. But this would be a step in the right direction by offering the public option. It would lower the cost, and it would offer significant competitive pressure on the private market to lower their prices as well. However, what Clinton is saying is, again, she doesn't want to eliminate the ACA, God forbid, that's holy, and so how can you fit in the public option within the current framework? And so what she's saying is she's going to allow the states to set up that option. So you're going to pay the premiums not to the federal government, but to the states. Okay? And so she says there's wiggle room within the ACA for the federal government to allow the states to do that. But again, this is a very specious argument because the states will not do so. Simply saying I'm going to allow the states as if that's going to solve the problem, it's not going to happen because for the same reason that Obamacare couldn't get the public option in the ACA 2009 law, namely because all of these entrenched providers were resistant to it because they were going to suffer a financial loss. They wanted their money. Okay, they wanted their business. Notwithstanding, that is bad for the consumer because who cares about the consumer? All I want is my money if I'm a doctor or a pharmaceutical company or whatever. Okay, and that's ultimately the central problem here. The problem here is it's us, meaning the common citizen, versus the providers who are trying to keep the costs artificially up. And unless you have a solution to this problem, then simply saying I support it and I'm going to allow the states to do this, no, the states are not going to do it for the same reason the federal government couldn't do it. Okay? So again, so you need to seize the initiative here and lead by federal policy. That is the way to go. I'm not necessarily saying that this is the way. It certainly could be done on the state level, but not by simply saying I'm going to incentivize them to do so. It has to be done through serious initiative here. You have to take on these big special interests. That's what you have to do. And clearly Clinton is not going to do that. There's nothing that indicates that she will. So that is it. This conversation took 42 minutes. Way longer than it should have. I don't know. Am I rambling? I'm not sure. Forgive me. I don't think anybody is with me by now after listening to 42 minutes. But I'm sorry. This is the only way that I guess that I can express myself. So if you're with me, you're a hero. Honestly, you're a hero. But finally, let me summarize. Let me summarize the positions here. So at the end of the day, most of Hillary's arguments here are specious. They're fake. Okay, they're designed to sound good. I'm gonna crack down on prescription drug prices. I'm gonna offer public option. I'm gonna lower the cost, and I'm gonna. Oh, I forgot to mention one item. She says she's gonna allocate $500 million in advertising for Affordable Care Act coverage. Okay, as if the problem right now is that people are just not aware of it. This is just so ridiculous. This is another thing that I hate about Clinton. Like everything, she finds a way of scapegoating some component of the picture that is just not the problem. She figures out a way of finding this thing. Like that's not the issue. The issue is not that people are not aware of it. And this $500 million that she proposes to spend on this, utter waste of money. Complete waste of money. It's a boondoggle. If you believe in boondoggles, go right ahead. Okay, there's going to be plenty of people who are going to have jobs, they're going to set up offices, facilitators, whatever the heck, and yes, they're going to have jobs. But it doesn't solve any problem. That's not the problem that we have, is that people are not aware. And so again, Clinton's positions are, most of them are completely ridiculous. They sound good, but they're all style, no substance. Whereas Trump's positions are great. Many of them. Okay, not all of them. Again, I mentioned that the state border restrictions, that's not necessarily going to solve anything. But other than that, most of his positions, assuming that there is no universal coverage, okay, are great options. Now again, comparing them to the current status of the ACA, I still think that they're great alternatives. Because like I said, the current big problem with exchange policies is that the deductibles are too high. And so I would be totally open to completely repealing Obamacare and trying something else. Assuming that we're not going to provide universal coverage, which I think is the best option. But the current status of the ACA is better than the status quo prior to its enactment, but it's not necessarily superior to Trump's plan. That's basically what I'm trying to say. All right, so thanks for watching, and have a good day.